Okay, good afternoon, everyone. Welcome to our regular Friday afternoon, 3 o'clock webinar. We're excited to have everyone on board with us. I think we have a topic that's going to be very, very germane to everyone who's on today. I'm Marquita Wiley, and I'll begin by welcoming you first to the webinar and remind that we have a brief update first on the COVID-19 relief programs that are affecting all small businesses. And then in addition to the update on the SBA and Treasury programs, we will hear from a special guest today, and he will present information you need regarding reopening your business in your workplace. We know we're all looking forward to the reopening phase now, and I think this information is quite pertinent now. But first, let me go over the logistics for the webinar. I do this every week. Many of you who've been on with us know the game, but it's Zoom is our portal. We're using the Zoom webinar interface. We welcome questions. We want you to ask questions throughout the webinar, and you'll use the Q&A tab in the bottom near middle of your screen to ask your questions. We will key in answers as we move forward during the webinar, but most questions will be asked on your behalf verbally as we go into the 30-minute Q&A session and answered by our panelists verbally on the webinar. If we have more questions than we're able to answer during the Q&A period, we will provide a transcript of all the questions along with their answers when we post the webinar recording to our YouTube page. Okay, so first let me introduce today's topic. Terry Lammers and Steve Denny are on again today. Steve and Terry are our managing members of Innovative Business Advisors. Steve will present the update on the COVID-19 programs. Terry and I will be available to answer questions both during and during the Q&A period. But I want to make sure you're aware that we have a special panelist today, Tim Murch, Chairman and CEO of 4M Building Solutions. Tim will present the topic, Reentry Preparedness Plan, the new normal. You're going to find this very, very interesting. So with that said, Steve, I'm turning it over to you.
Excellent. Marquita, thank you very much. You do a wonderful job, and we appreciate very much you taking the time to moderate these panels every Friday afternoon. Folks, as we began a couple of weeks ago, our theme is preparing to thrive. We know this has been a challenging time, and it brings out the best in the entrepreneurial community. And we're here to make sure that you guys have some extraordinary resources to help you as you begin to reopen and really prepare to thrive. So we'll move on and just give you a quick overview of the agenda today. We're going to talk a little bit about economic updates. There are a couple of things that have been updated regarding the PPP program. And then we've got an incredible featured guest, and I'll be introducing you to Mr. Murch as we move into the program. So let me start off on a low note, and hopefully we'll move up from here. But yesterday there was in excess of 3 million additional jobless claims that were filed within the past week. I say the silver lining to this is the trend continues to go down. So we're in unprecedented territory in our nation's history. We've got more people out of work now than ever before, and we're all very hopeful that it's a very temporary situation. The second round of the PPP program is open and very active. Much to our surprise, there's still money available, and a significant amount of money available. What's really interesting in the round two is that the average loan size has gone down to $79,000, which would give you some indication that, as you can see, the amount of loan volume is up from where it was before. So it really appears to be reaching the small business community and reaching that community in a very large way, which is quite encouraging. We've also taken the time to provide some stats on where the loans are going. So again, I just want to remind you that these slides are available in the replay and as a download as part of that replay. So if you're curious as to how your state is performing, you'll be able to come back and refer to these. Quite interesting. The big states are continuing to do well. In this instance, California is the one that took the lead and knocked Texas off the top. So, but certainly California and New York are the big leaders in round two. All right, let's move on to probably one of the most frequently asked questions that we've had over the past week, and there is a little bit of new guidance in this regard. So that question is PPP loan forgiveness. The people that receive the earliest Paycheck Protection loans have now had them in hand for almost 4 weeks and are beginning to think about, am I doing the right thing and am I going to get this loan forgiven? So as we see it right now, it's going to be a two-step process from a forgiveness standpoint. And I must caution you and say that the SBA has not provided a lot of guidance on this yet. We're fully expecting in the coming weeks that we will get a lot more information. But the information we're sharing with you today comes from our discussions with a lot of folks in the accounting field and in the banking field. So we believe that it's going to be something like a two-step process. So again, the PPP loan is going to be, your forgiveness is going to be calculated on how you spent the money in the 8 weeks following the date of which you received the money. And as everybody's well aware, payroll and benefits should be 75% or more of the spending that you use the money for. And in that instance, that's one of the thresholds of getting forgiveness. From many of the lenders that we've talked with, the primary mode of verifying the borrower's certification, and keep in mind that as a borrower, the borrower has to apply for forgiveness and then certify to the lender how they use the funds. We're hearing from a lot of banks that it'll probably be very useful to use your 941 reporting, payroll reporting records as substantiation of how you use the funds. And just as another reminder, you know, the other 25% can be used for the existing utilities, your existing rent or lease payments, and interest on your existing debt. There's a lot of discussion about the forgiveness and whether it would be reduced based on head count or whether wages have been cut. We're looking forward to more guidance in the future, but as of right now, we don't have any real definitive information to hand to you. But I expect that in the next week or two, we should begin to be able to answer those questions in a very factual way based on SBA guidance. One thing that did come out this week is the IRS issued a document, and they are talking specifically about how is the tax treatment of your PPP loan going to take place. So we want to remind you that if you've taken a PPP loan, your bookkeeping and your tax reporting are definitely going to be different. So the IRS has come out and said that your PPP loan amount, the forgivable portion of your loan amount, will not be reported as taxable income. So you won't have to add that to the income of your business, and it will not be reported as taxable income. However, your expenses, so the forgivable amount of your loan that was used to cover business expenses, payroll, utilities, interest, rent, etc., those expenses also cannot be reported on your tax return as a tax deductible expense. So you're going to have to be very careful about the way you do your bookkeeping, and your bookkeeping may be different than your tax reporting this year because you'll have this income that is forgiven based on the way you spent it. And you want to make sure that you're not reporting forgivable expenses on your tax returns. And just a simple reminder, for those that are doing cash-based accounting and cash-based tax reporting, you know, you can't switch back and forth between cash and accrual basis in the middle of the year. So, you know, don't think that maybe one of the ways you can game the system is moving back and forth. That's certainly not allowed. Also want to take a couple of minutes and remind those that have not taken advantage of the PPP program that there is the employee retention tax credit that is available for you. And this allows you to get direct reimbursement from the IRS for the payroll that you have expended to keep people employed. So if you haven't used your PPP and you're not taking advantage of the employee retention tax credit, we certainly encourage you to talk with your tax professionals and your payroll providers and make sure that you do take care and advantage of the benefits that are available to you. Finally, another thing that's come up this week that has been a little bit surprising, and we just wanted to take a few minutes and reemphasize it here, is that the federal law now requires employers that have less than 500 employees to provide paid time off for their workers for COVID-19 occurrences. So, you know, we've talked with many of the clients within our network that have people that are out for furlough or may have taken time off, and the employers did not compensate them for these periods of time. But remember that the CARES Act created a requirement on all employers that have employees of less than 500 to provide this time. So if you're one of those employers that had people that were off due to COVID-19 and you did not, you know, cover their payroll during that period of time, you really need to review the laws and make sure that you're compliant. The worst thing that could happen is for your employee to get some knowledge about that and then basically be in a position of filing a claim against you. And you certainly don't want to be in a position of having to play defense. So take the time and take a look at that. It is not the same as it used to be in January. The law changed things in March. So please pay attention to what the new CARES Act provided for you. So that's our update. And I'm really excited to introduce you today to Mr. Tim Murch. Tim is Chairman and CEO of 4M Building Solutions. They are a regional cleaning company, very large in scope and size. And Tim is a multi-generational now owner, which is a very exciting thing as well. They're celebrating, I think, 40-year anniversary in the business. And Tim is an expert and speaker in these areas, and we're honored that Tim would give us the time today and give us a short overview of how all of you can begin to open up safely in your environment. So Tim, thank you very much for participating, and I'll turn the dais over to you.
Very good, Steve. Thank you very much, and great afternoon, everybody. As Steve said, I'm Chairman and CEO of 4M Building Solutions. We operate in 16 states. We clean over 100 million square feet every day and night with over 4,000 team members. So with that, I've got a lot of information that you all can use in your business to be prepared for reentry that hopefully will be very helpful. So my objective at 4M is to always be a progressive leader, providing leading edge solutions as a trusted industry advisor. So it's all about being prepared as much as possible. And our focus moving forward is providing peace of mind. And you're going to hear that several times from me today. Peace of mind for all of our customers with a safe, healthy, clean, sanitized, and disinfected workplace on an ongoing basis, much more so now than ever. So everyone needs to know that all the health and medical experts are talking about another 1 to 2 resurgences of the pandemic over the next 1 to 2 years. So everyone needs to be prepared. Keep your guard up with firm protocol so you aren't the one that ends up with a positive COVID case that can infect your entire workplace. I also have a lot of information and reference material to help you at the end of the presentation, which will be available to you. Next slide. So when will the new normal begin? So the new normal is now, and we're in it, and will be an ongoing, challenging, fluid situation that everyone's needs can adapt to from now on. So the reentry of buildings and the facilities will be determined by several different criteria. One being vertical market. Some industries lend themselves to social distancing, and the work can or cannot be done from home. So it's essential versus not essential businesses. So you may want to look at what happened with the meatpacking industry recently without social distancing in their workplace. So they've had massive outbreaks. The same with long-term care nursing facilities. So that's a challenge. Other is location. Some states and municipalities will lift shelter-in-place orders for others, which we're all starting to see all around the country, with St. Louis starting to open up a week from Monday on May 18th for restaurants, retail, and other businesses. The company. Some companies may have their own specific policies in place developed for the pandemic as to when reentry can occur. So it may be a full reentry, It may be a partial or gradual or all in waves. So there are going to be many variations of reentry with regular hours, split shifts, optional or designated shifts throughout the 24-hour day. We're even seeing some corporate clients that are going 1 week on at work and then 1 week at home back to work. And the reason for that is if there's somebody that's infected, that usually shows up after the fact and it's too late. So they want to have it surface at home as compared to at work. And then some may continue to work from home from a comfort level or by design. The individual's health risk. So we've got individuals in the higher risk with age or a compromised immune system. And they will need to continue to be addressed on an ongoing basis as being very susceptible to the COVID virus. So as an example, our company, our corporate office here, and our regional offices around the country are open, but we're strongly encouraging most everybody to continue to work from home, and we'll gradually allow team members back in with a split schedule to minimize occupancy, all with very, very strict protocol on face masks. Here's mine. Anytime I leave my office, I have my face mask on, and along with social distancing at all times and constant disinfecting. Next slide. So how do you prepare for the reentry? So the building or facility has to be confirmed safe, secure, and CDC disinfectant compliant for every reentry to protect all occupants. The employees, tenants, and visitors have to feel and know it is very safe, minimizing any fear or concerns. Again, that peace of mind. There has to be a formal agreed upon plan for ongoing sanitizing and disinfecting procedures that are ideally very visible to all those in the building to ensure the workplace is safe for everybody's peace of mind. So again, it only takes one infected person to infect an entire building or facility. So the scope of cleaning services, the cleaning specs, the requirements of what the janitorial cleaning requirements are, and the frequencies of services will need to be revised. What everybody needs to know is disinfecting has not been a part of the normal janitorial cleaning task and specifications. Disinfecting takes more time, special expensive disinfecting products, and a dwell time, depending upon the disinfectant used, of 1 to 10 minutes of kill time to kill the virus and all germs and infectious pathogens. So you'll need to address this with your janitorial provider with full understanding and expectations all agreed to. Next slide. So preparing the building or the facility, the important first step for reentry. So number one, has the building been disinfected if there was a positive or suspected COVID case? So we've got special protocol for this, which I'll cover in Q&A. Number two, have all high-touch areas been disinfected as a precaution from anyone potentially being positive without knowing it? Again, the asymptomatic,
Asymptomatic.
Yeah, boy, that's a tough one. So this must be ongoing. So all office areas, restrooms, break areas, stairwells, copy areas, conference rooms, et cetera, et cetera. Number three, have restrooms, break rooms, and other high traffic areas been retrofitted with touchless upgrades? This is something that can be done beforehand and ongoing. So thinking about paper towel and hand soap dispensers. Touchless is the way to go in the future. Faucets and toilet flush valves that flush automatically, that you don't have to use your hands. Light switch motion sensors. You don't have to turn on the light switch. Hand and soap dispensers that are touchless. Toe pull door openers that you can install on the bottom of a restroom door or other doors that you don't have to use your hands to open the door. And individually wrapped dining area cutlery dispensers from a safety and, again, peace of mind standpoint. So again, minimizing all touch points and making it much more safe and giving the occupants peace of mind. Number four, are disinfectants available to everybody as they re-enter the building or the facility? So all entry areas, elevators, public areas, stairwells, break, coffee areas, copy areas, restrooms, vending machines, workstations, and conference rooms. So ideally, you're going to be providing hand sanitizer and disinfectant wipes. Next slide. So communicating safety is extremely important, letting everybody know the workplace is sanitized and disinfected, reducing anxiety and fear. Initially, 8 weeks ago, it was a huge fear factor, and it continues and will be even more so as people re-enter the workplace. So a tremendous amount of stress that we need to eliminate in regards to that. So let's have visible communication with lobby signs, desk signs saying that your office was sanitized and disinfected, hand washing reminders. There are some incredibly embarrassing and horrific statistics on how many people wash their hands after going to the bathroom and how many don't. Coughing and sneezing into your elbow, social distancing of at least 6 feet, and directional walkthrough patterns through your office areas to minimizing traffic. Number 2, new protocols, temperature scans. A lot of companies are going with temperature scans before you can enter the building. Testing for negative confirmation. Social distancing of 6 feet, workstation distancing. That's going to be reconfigurations of office areas or one day on, one day off, spreading the workplace around so that you have at least 6 foot in between people working there. Shared workstation and disinfecting procedures, and then managing building occupancy with continued or partial work from home. Number 3, new precautions, providing the access to hand sanitizer and disinfecting wipes, as well as face masks and gloves. So it's a OSHA regulation that every janitorial cleaning personnel wear a mask while they're in an office building or any facility cleaning. We're requiring everyone at our corporate office and our regional offices to wear a mask whenever they enter a building or leave your office for any reason to interface with another team member, go get coffee, go to the restroom, or go to the copier. Number 4, new procedures. Ongoing increased frequency of disinfecting of high-touch areas. High visibility daytime cleaning by disinfecting specialists who stand out. We're putting those team members in white lab coats with PPE. Scheduling regular electrostatic spraying disinfecting. So be proactive. And again, you just need to understand what is the cost of one case. It's astronomical. And I'll get into electrostatic spraying in a while, but it's the most effective. It's very safe, yet it kills 99.99% of virus and all pathogens. It can be used in office buildings, factories, any type of facility or building, schools, including electronics, keyboards, and papers. It's a charged disinfectant. The particles come out of the disinfectant come out charged, and they completely encapsulate everything that they're sprayed on, disinfecting it in a 360-degree surface coverage. And then we're even taking it a step further with ATP testing to show the before and after readings of the pathogens in the area, which are extremely dramatic. Next slide. And these are just services that we provide in regards to the pandemic in our new normal. As mentioned, ongoing disinfecting, converting to touchless dispensers and faucets and paper and soap. New protocol in regards to signage, constant reminders throughout the workplace. And then again, that peace of mind, increased visibility, daytime disinfecting, and then sanitizing and disinfecting supplies that we can provide. And we also are providing health temperature screening with infrared thermometers. There are a lot of facilities, mostly in the corporate side, they're going to require. And we're going to start it here as soon as our thermometers come in the next week or so, where everybody have their temperature taken when they enter the building. Next slide. So yes, we're committed to keeping our Forum family safe while providing assurance your family stays safe too. That's our commitment to all of our customers. Next slide. So we put together several weeks ago, initially, in the pandemic started out, and we got a lot of the same questions over and over. So we put these together and then prepared answers for them. So these were the top 5 frequently asked questions by customers, and they were put together by Tom Guvilli, who's our Vice President of Safety and Risk Management for 4M, and he's also a certified industrial hygienist, and along with our executive leadership team. So number 1, what is your process if there's a confirmed or suspected COVID case in my building, my facility, with a tenant or employee who works here, or with one of the 4M team members? So the answer is the 4M requests prompt notification of any confirmed or suspected COVID case in any building or facility in any pandemic or other applicable policy our client's management, ownership, or safety department may have. So 4M evaluates special areas of concern, such as the infected person's office, work area, and all other areas where the person may have frequented. In the case of any suspected or confirmed 4M team member or one of your team members, we would immediately notify the client management and require the team member to self-quarantine. We'd also request as an unencumbered access to areas to be cleaned, disinfected as possible. Depending on the type of disinfection, whether it's manual or electrostatically, we will cordon off areas as necessary. We do not undertake. So 4M's efforts are first and foremost focused on the health and safety of the employees, the visitors, the tenants, and our team members. We've established a procedure that addresses known or suspected COVID-19 cases, which has already been implemented at a number of locations, all in accordance with strict CDC guidelines. So our team members would then clean and disinfect at a frequency agreed upon with our client, and with a focus largely on frequently touched items. Our team members will have proactive gowns or Tyvek coveralls, face masks, or respirator, depending on the method of disinfectant application. Electrostatic applications will require an N95 respirator or higher grade, eye protection, goggles, booties, and disposable gloves. So question number 2, is your sanitation and disinfecting process compliant and consistent with the CDC guidelines, and are your products EPA registered for COVID-19? So yes, our sanitation and disinfecting processes meets and exceeds all CDC interim recommendations for U.S. community facilities with suspected confirmed coronavirus disease guidelines. We will only use disinfectants that are all EPA registered as effective against the COVID-19 virus. When possible, we use disinfectants that have a shorter dwell kill time, down to 1 minute. That's our preferred. Question number 3, can you supply additional labor to disinfect and sanitize touchpoint areas or areas that have been in contact with someone with confirmed COVID-19 virus? Yes, as you can imagine, our situation is very dynamic, very fluid, with some clients in a particular shutdown and other clients requesting a lot of additional disinfecting services. We are able to supply additional disinfecting specialists and can provide these services where and when they're needed on a requested basis, and most of these are going to be ongoing and a permanent situation. Number 4, what are most of your other customers doing to proactively disinfect and sanitize their buildings during this period? Well, most all of our clients are adding additional team members to disinfect and sanitize touchpoint areas and proactively electrostatic spray disinfect. Most customers are evaluating their current protocols and how they will reopen and respond to potential resurgence situations in the future. Number 5, what happens if I shut down or partially shut down until it's safe for people to re-enter the building facility? Well, this has been ongoing, and shutdowns in buildings, partial or full, have occurred and at numerous of our customer sites. So this has allowed our team members to do their jobs unencumbered, allowing them to focus on detailed cleaning along with disinfecting, since the building is vacant or partially vacant. So some of the disinfection we provide, including the electrostatic application, does require that immediate area be disinfected to be temporarily vacated only for about 10 to 20 minutes. So we're currently in the process of discussing the next steps with our client management regarding the timing and processes for reentry, which is starting to occur. Next slide. In this last slide are just a sampling of some of the things that I mentioned that are basically handouts and attachments that'll be available for you all. And one is a detailed explanation of the electrostatic spray disinfecting. The other one is the process of re-entering the new normal and the difference between cleaning, sanitizing, and disinfecting. A fun fact that I mentioned earlier, just 1 in 5, I would say, men wash their hands after using the bathroom, which one of my managers said is absolutely gross. A single germ can multiply to more than 8 million germs in one day. So there are a lot of fun facts out there, including most coffee cups in the cupboard at our office buildings. And all of our facilities around the country are just ridiculously confirmed with germs. So there's a lot more behind the scenes with this invisible enemy, and how we can protect you and help you, along with all the other qualified partners out there. So in wrapping up, I just want to stress there are a couple of things that I really encourage you to do, is to look at the high touch point disinfecting on an ongoing basis. Be proactive with the electrostatic spray disinfecting program. It's extremely effective. Revise your scope of work, the cleaning specification, to include these in daily, weekly, and more frequent frequencies with the new normal expectations. Have very strict protocol, without any exceptions, on temperatures, mask, 6-foot social distancing, and the signage that supports that, and provide hand sanitizer and disinfecting wipes for your occupants, employees. And then we can help you with any of those. And then, as mentioned, there are several additional slides for reference of all this. So with that, as I always close out, stay healthy and stay positive.
Tim, thank you so much. Very, very insightful. So let's begin with a couple questions, and I'm going to ask you to speak somewhat generally on this topic and describe situations. We know that many of our listeners are manufacturing facilities where they may specifically own their building and be totally in control of the cleaning and sanitation efforts within their building. On the other hand, we have a large number of people also who are leasing space within an office complex, perhaps an office tower.
Right.
And as a result, depend on their landlord, in effect, to undertake those kinds of activities. I'd like your thoughts or guidance, Tim, on either or situation in terms of, as a business owner, how might I approach this in terms of assuring or ensuring that I am addressing sanitation in the context of this COVID emergency as I return at the level that you're talking about. And I'm saying this from knowledge of a specific building that I certainly walk into, that I don't see these levels of disinfecting going on or cleaning going on, but only the ongoing once a day cleaning as we've had in the past. Can you talk in general about that as a business owner? Process-wise, what should I know, and who do I go to make sure my people and my workspace is appropriate?
Yeah, that's a great question. And in regards to the manufacturing facilities, whether it's manufacturing, industrial, warehousing, logistics, or a corporate owner-occupied facility where they're in control of their own facility, that's where they can, pivot and turn on a dime and call the shots and instill the protocol and make the investment in the health of their employees and visitors by putting these programs in place. In regards to the lease space, and we, as I said, we clean, Caterpillar. It's 10 million plus square feet from an office and manufacturing facilities. education, same way with schools. And then you get into the multi-tenant world where you've got numerous businesses housing and operating out of an office building. So you've got the landlord. And what we're doing now is working with all of our property management customers, the building managers, and determining what they're going to provide, which is public space, the lobbies, the elevators, the stairwells, public areas, restrooms, in regards to what that additional service will be and the frequencies on those. And then the tenant space, obviously tenants have a lease with their customer, and most of our customers are saying that we need to work that out with the individual tenants in regards to any additional services. And it would be no different than us having a system set up where we have always, collected their dishes and washed their dishes or cleaned their microwave and things that are kind of outside the scope of service. Well, the same would be our carpet cleaning. The same would be for this disinfecting service for the individual tenants.
Great, thanks for that. I like what I heard you say about touchless retrofit. I know that you didn't come prepared to give us a proposal, so to speak, in terms of cost, but in general, as a business owner, let's say I've got a full floor, maybe let's put it around 3,000 square feet, 2 restrooms, two group restrooms in that area. Let's talk about touchless retrofit for entrance, exit to the perhaps break room, the restrooms. In general, what have you seen so far, and what's happening around availability of supplies to do that? I've got to only believe that like N1 or what we call them N90 masks will become somewhat scarce as people begin to realize the value of adding those sorts of retrofit to their buildings and their workspaces.
You have no idea how disrupted and upside down the supply chain is right now. It is absolutely the Wild West. And most all of the masks and a lot of the disinfectants, a lot of the hand sanitizers, call it the Purell, the gel form, has gone to the healthcare. And we've had things ordered and they just literally, truly get hijacked. So that's going to be the norm for probably the rest of this year in regards to the hand gel. Now we've procured and secured a lot of, we're talking pallets and pallets and pallets of hand sanitizer, but it's spray. So it does the same thing. It's at least 70, if not 80% alcohol content. And does the same thing. It just doesn't have that aloe, gel to it. So in regards to the touchless retrofit, you can go back 10 years and reaching up into a paper towel dispenser in the restroom because they're jammed up in there or you can't get them out and you're touching something that somebody else had just touched. It's just kind of unsettling. All right, so flash forward 2 months ago and in our new normal future, I've always been a proponent of the touchless paper towel dispenser. And all you do is hold your hand up to it and it comes out and you tear it off. And they've got soap dispensers that are the same way. They've got flushometers on toilets, urinals and commodes and toilets that flush automatically. So I think it's a matter of time before, and these are large capital expenses, so are the additional labor of disinfecting. But it's just one of those things that I think everybody's going to be moving to for that. Again, it's peace of mind. You wash your hands and then you got to go open the door with your hand, and it's like, okay, there's that ugly statistic of how many people didn't wash their hands before me when they open the door. So that's why you see paper towels all over the floor where people grab the towel and open the door and throw the towel on the floor, unfortunately. So that will be coming. They're fairly reasonable, and we can help out on that. Distributors are also very, very helpful on that. And in regards to supplies, so it's the point now where, so all the recycling that has been going on for white paper recycling. Well, nobody's been in their office and there isn't much recycling going on other than all the Amazon brown cardboard corrugated boxes. So there will be a supply issue because most of the paper, whether it's hand towels, tissue, and so forth, you're going to be seeing more brown hand towels because of availability and resources, because that white paper recycled component is not available. And it'll all change when people get back into the workplace, but it's been extremely disrupted and turned upside down, literally overnight. Same way with the masks. So we have over 4,000 team members, and we have procured enough masks where we want at least a 3-month inventory for all of our team members to have a mask, because it's OSHA required for every cleaner to have a mask on. And we want all of our team members in our office buildings, in our corporate and regional buildings, to have their mask right here. So when I leave this room, go back to my office, I'm going to put that on and as a requirement. And it's all, again, proactive peace of mind. So everybody's on board. They're all for it. And it's a commitment, and it's a way things will be moving forward.
Another question for you, Tim, related to liability and legal liability. And I know we're very early in dealing with this as a new threat, if you will, to our safety, our individual health, our individual safety. What do you see on the horizon? And it's interesting, my daughter and I were having a conversation about this morning, because already we were watching news reports about suits from labor unions regarding their employees, suits from individual employees regarding going to or not going back into the workplace. And I realize that you're not an attorney unless there's something in your background I don't know. But with that said, as CEO of your firm and looking out and seeing this as a totally new area of potential liability for business owners, building owners, what are your thoughts going forward?
Well, Marquita, you were doing pretty good until you asked that question. No, the facts are the facts. I read a long legal brief last night, as a matter of fact. One was from California, and then another one this morning from Massachusetts. And Illinois, I want to say early, middle last week, got repealed. It was driven by the unions that any and all COVID cases can be claimed as workers' compensation. Well, when you're an employer and you hear that, I mean, I've got goosebumps right now. They're about a half inch tall. It just gives, sends, shivers down your spine. So that is going to be, when this happened, I just said, man, the good old lawyers are going to have a feeding frenzy on this. It's out there. I think we've got lobbyists in our industry association that are going to justify nobody on God's green earth can validate and verify where somebody contracted COVID, whether it was on their way to work, whether it was at work, whether it was on the bus, or whether it was at the grocery store or wherever it was. So that cannot be proven. So we've got red states and blue states, and we've got some states that are going to be a lot more aggressive on it, and then some states that are going to be more pro employer on it. But it's very, very concerning, because it's unfair to an employer when you can't prove it. Although when you take care of your team members or employees the way they should be covered, and they should have benefits. So that shouldn't be a concern where it automatically falls onto the employer.
I think Illinois actually got the reverse, Tim.
I meant to say that last week was well, there's a stay on it, which is a good start.
Okay.
Tim, I've got a question for you as well. you gave some incredibly great advice, and thinking about we're all having to change our habits and the way that we conduct ourselves, particularly when we're in these public spaces. Do you guys have a position about priority of actions, i.e., do you recommend that signage happens first and then, or that sanitation happens first and then signage and then retrofitting fixtures? Do you have a particular priority of action that you would recommend a building owner or an employer, a major employer take?
Yeah, I tell you, again, very good question. In that guidelines, basically checkoff list that I sent you all, it'll also be included as a handout for today's attendees. That has a lot of what you just asked in it, and you can pick and choose. But in regards to the sanitation and disinfecting, that shouldn't be a want to or a like to. That should be a must have. And then the signage, that's up to each individual company. And it's again, we're changing habits. We're changing the way people used to do things. You get in an elevator, okay, we can only get 4 people in an elevator now, depending on the size of the elevator, and no more. It's no different than in the checkout line at the grocery store, 6 feet away from each other. So we're all going to be getting in this new habit. And in regards to the signage goes, these are going to be reminders. So we've shared some things where they've got walk-off mats and directional signals that basically say, okay, this hallway is this way and the other side is that way, just to really limit people from coming in contact with one another, even though you can stand 6 feet apart and converse. And again, in the restrooms, washing the hands, just the reminders of, if you sneeze into your shirt, and ideally away from anybody and everybody. And these are all, because that's as contagious as the virus is, that's one of the, the biggest ways for it to spread.
Excellent. Got another question here, and that is OSHA required changes. I can just imagine that you guys are probably bracing for a lot of that. Do you want to speak to what you've seen so far, and do you have any guess about what might be expected in the future?
We've got a task force, and we visit literally daily on it. And OSHA's actually been pretty good as compared to really going off the deep end. And I want to say that if you're doing these things we say, you're going to be in pretty good shape. Really one of the biggest things that's affected us is we want to be compliant with the CDC and OSHA and the EPA in regards to the products that we're utilizing in the workplace. So, really the only new one is the mask for all of our team members while they're in the workplaces cleaning. But I know that everybody is inundated and overwhelmed to an incredible extent, as you all are well aware with the loan applications. And when people start to get their head above water, Lord knows what can happen.
Yeah. Another interesting question here. The public markets have been struggling to fulfill the need for toilet paper. How is it in your markets?
Yeah, we've been able to get them. So we've gone to Georgia Pacific, Kimberly-Clark, and a couple of the other large players in the industry that we've got basically a GPO, General Purchasing Organization, we put together with a lot of the larger companies in the industry. So we've got a pretty good pipeline. So what they've done is basically reduce SKUs from numerous product lines in regards to toilet paper, and they're only going to have a couple. So what they've been able to do is run 24/7 instead of producing all these different various type of products. They're going to have a lot more of fewer SKU products. So I think the toilet paper situation once the word got out about the China situation, it was no different than a snow day. Everybody runs to the grocery store and grabs all the milk and eggs and bread, and there's nothing left. And that did happen with toilet paper. There's plenty of toilet paper out there. It's just in inventory in everybody's houses.
Excellent.
Okay.
For me,
Go
for me
ahead,
personally,
Steve.
I had one question of my own, and that is, there's been some press about, particularly over in the Asian countries, where they're using robotic UV and various high-tech equipment to do some sanitizing. Is any of that occurring in North America right now?
Yeah, real good question. So the Building Owners and Managers Association, which is a lot of our customers in the multi-tenant world and facilities management world, they've got their own guidelines, and in there that they came out with about a month ago, it said utilize UV light for disinfecting. So UV lights, it's great in an operating room where you can set it up, but anything in its shadow, if you set a UV light up in this room, and anything in its shadow will not get disinfected. So yeah, they do have robotics. Actually, I saw something on LinkedIn 2 days ago, and these are like for airport concourses and school hallways and large convention centers, large open areas. And it's a real quick kill time, but there can't be anything in its path. But for an office building or a manufacturing facility or a school, to utilize UV, it's just not practical. They're extremely, I mean, ridiculously expensive, like $27,000 for just one unit, and that's non-robotic. And then you need to go around and move that, let it do its thing and move it. So that's where this electrostatic is much more practical from productivity standpoint and coverage, because it covers everything in its path with the charged particles.
Excellent.
Well, Tim, I'll make a comment and ask you to speak on it, and we're going to start to wrap up in a minute here. But it seems to me that as I look at your industry generally, in the past, and we often speak on this particular webinar about before COVID-19, during COVID-19, and in the future after COVID-19, your industry very specifically is one that I would expect would rise substantially in terms of demand, both in terms of demand in the context of the way the industry has supported our businesses in the past, but also that we would see a substantial amount of creativity and innovation coming in your industry, because we're going to need to come up with new solutions in terms of how we keep people safe in this environment. I'd like to know your thoughts on that, and then we'll start to wrap up.
Yeah, and this is unrehearsed a question, but Marquita, you're finishing on a very strong note, because if you look at the heading above there, it's Forum Building Solutions. We're in the solutions business. We're in the people business. We're all about innovation and innovative solutions. So yeah, it is going to be different, and that's where we want to be out in front as I opened up with solutions. And you know, it's neat. I was on a little a Zoom meeting the other night with some peers across the country, and it's amazing. We've had tremendous, I mean, absolutely, great rapport and respect, credibility with our customers through the years. But I'll tell you, over the past 2 months, with bringing them solutions, bringing them answers to the questions before they ask them, bringing them these guidelines and how-tos, they look at us and our team members who are putting themselves out there, going into the workplace every day and every night in a much higher regard. And it's very gratifying. We do a lot of recognition throughout our company, and I can't tell you the compliments that I continue to get literally every day that we recognize and acknowledge from customers that are so appreciative, because they recognize and they do know our team members are putting themselves in harm's way by exposing themselves into the workplace as compared to staying home. they need to work, and a lot of them want to work as compared to, staying home and collecting unemployment.
Tim, thanks so much. We're going to begin to wrap up here. And what I always like to do on the wrap up is to give each of our panelists an opportunity to impart their last thoughts as we move forward. And Tim, I'm going to start with you. Do you have any last thoughts for our audience before we close the webinar out?
No, I would just say it's going to be changing. It's going to be fluid. In our world, in my world, it literally changes every hour, every day, every week. So we need to know that. We've got to understand it. And, with things opening up, everybody can't be silly. And continue to keep your guard up, both personally as well as with your coworkers and your employees, team members, so that we don't have a nasty reoccurrence and we're back to square one.
Thanks, Tim. Terry, your last thoughts.
I think you made a good point there, Tim, in saying that things are fluid. So Steve and I really look at the COVID financial stuff, but maybe, a little bit more, but things are also very fluid there. So, and as we transition from things are shutting down to programs are being introduced to things are now being opened back up. And as Steve mentioned earlier, now all of a sudden, I think the next wave is going to be, how do we report the expenses that we spent on the PPP program and get them forgiven as they was intended to. So there seems to be daily changes in that. So I would encourage people to stay tuned and we'll keep you up to date.
Thanks, Terry. And Steve, you get the absolute last word.
Well, again, Marquita, thank you very much for giving us your Friday afternoons and moderating these panels. We appreciate it so much, and you do a wonderful job. And Tim, I got to say, you have been incredibly gracious in providing an amazing amount of resources, which we're going to be attaching to the email that goes out to the attendees, and then we'll attach to the replay as well. So anybody that goes back to watch the replay will be able to pull down those resources. I know you've got your contact information on there. We've provided the website and your 800 number. You are in 16 states around the country, and we highly recommend that people reach out to you. You've been incredibly generous with your time today. I think folks got a lot out of how do they need to prepare to reopen and re-engage with the public in their workforces, and we are very, very thankful for you giving us your time today to do this. We wish you and your company all the best. And we just want to say for all those in our audience, listen, this is an unprecedented time. We have to put our thinking caps on and figure out how we're going to thrive in this new normal. And companies like Tim's are there to help you. So please reach out to them, reach out to these experts, use their best practices and use them specifically as you begin to thrive into the future with you and your organization. So thank you very much again for your attention this Friday, and we'll look forward to seeing you all again next Friday. Take care.
Thank you, Steve.
Great weekend.